Hi everybody, this is Dr. Anugraha here. Today let's talk about mallet finger. Let's start with a clinical example. A 25-year-old male comes to your clinic and tells you, or first he comes to you and you notice this kind of finger, okay? And he tells you that he has severe pain over this area and he's not able to extend the fingertip. Okay, let's take an example of index finger. He also gives you history that he got hit by a baseball. Okay, since then he's having pain and he's not able to extend his fingertip. So what it could be? Yes, this is a case of mallet finger. Now, why is it called as a mallet finger? Let's talk about why it happens, why a hit over the fingertip causes this kind of deformity. What are the symptoms? Let's talk about all that. Now, before that, let's ask, why is it called as a mallet finger? What do you mean by mallet, guys? A mallet means a hammer, right? So to some people it might, to me it doesn't look like a hammer, but to some people it looks like a hammer. So that's why it got the name mallet finger, okay? The other names of this disease or this kind of deformity is swan neck deformity or a baseball finger. Swan neck deformity because it looks like a swan neck. I'll show you the pictures at the end of this section, okay? It'll be much clearer. Why is it called as a baseball finger, guys? Because usually the patient gets hit by a baseball over the tip of the finger and then he comes to you or presents with this deformity. That's why the name baseball finger. Now, we learned about the symptoms. In the question itself, I told you the symptoms of mallet finger. What are they? There'll be pain and the patient will not be able to extend his distal interphalangeal joint. This is your distal interphalangeal joint, right? This is your middle interphalangeal joint. This is your proximal interphalangeal joint. I hope you know all these, right? Yeah. Next, we'll talk about the mechanism why it happens. See, why getting a hit by a baseball over the tip of the finger causes this kind of injury. For that, you should know a little bit of anatomy related to that area, okay? I'll tell you the pathway of one muscle. You must tell me or tell it in your mind which muscle I'm talking about, okay? That is a muscle related to the mallet finger, okay? So a muscle that starts from the lateral epicondyle of your humerus, okay? From here it starts, then it goes down, okay? It is a superficial muscle of the posterior compartment of the forearm, all right? So it starts from here, it goes down, and at the area of the wrist, the muscle stops and continues as tendon to these four fingers. I'll say it once again. This muscle that I'm talking about starts from the lateral epicondyle of the humerus. It goes down the posterior compartment. It goes down the forearm and it continues as tendon towards these four fingers, right? Which muscle am I talking about? Which is involved in extension of all these four fingers except the thumb. These four fingers I'm able to extend because of the help of this muscle. That is excellent. Extensor digitorum, okay? Now, these four, I told you there are four individual tendons running from here. The muscle ends as a tendon, right? So there are four individual tendons running from here and they end where all? They end in the middle and the distal phalanx. They get attached to the middle and the distal phalanx of all these four fingers. So because of these tendons, I'm able to extend my four fingers, right? What happens in baseball injuries? Suppose, let's say let's take this finger for example, the index finger. I got hit by a baseball. Okay, what happens is, when there is a sudden force over here, there is a chance that the tendon over the distal interphalangeal joint might tear, all right? And this causes bending of the distal phalanx. So when the tendon is here, I'm able to hold my finger like this, right? Now, when there is a hit, the tendon at this part, the distal interphalanx, the distal interphalangeal joint, okay, that tendon might tear and this causes bending of my distal phalanx. This is mallet finger. Alright, guys? Now, the investigations, yeah. Basically, the symptoms a patient tells you, and you can also check it clinically. You ask the patient to extend his distal interphalangeal joint. He tries, but he cannot. And then we'll do an X-ray. There also you can see, suppose if the bone of the distal, that is the distal phalanx, if that bone is broken. That also can be clearly seen in the X-ray. Let's talk about the treatment finally, and then I'll show you the pictures of mallet finger, then we'll call it a day. Alright. So the treatment includes keeping a splint. See, whenever there is an injury, mostly in orthopedics, the first form of treatment is immobilize that area. If there is a fracture, a tendon tear, just immobilize it, right? So you keep a splint for about 4 to 6 weeks, or up to 8 weeks also you can keep until the injury heals. Alright. You must remember that when you keep a splint here, the proximal interphalangeal joint, you ask the patient to move a bit. It shouldn't be completely immobilized. The proximal interphalangeal joint has no problem here. So you ask him to move a bit the proximal interphalangeal joint without injuring or without moving the distal interphalangeal joint. Okay. That's it about the treatment. And also, if that doesn't work, we can go for surgery in serious cases or severe cases. You can go for surgery. That's all about mallet finger. Let's move to the pictures. Okay. Let's see the picture of a mallet finger. See, this is your mallet finger. Can you see the bend over the distal interphalangeal joint? Yes? Yeah. This is a picture of a mallet, a hammer. So yeah, your mallet finger and the hammer look somewhat similar, hence the name mallet finger. Okay. Below is a picture of a swan. Okay. The swan neck somewhat correlates with, or it looks similar with your mallet finger. So your mallet finger, other name is what? Swan neck deformity. Alright. Next, the X-ray. It's very easy to spot in the X-ray. Can you see? There is an avulsion here, avulsion of the distal phalanx. Yes. Yeah, this kind of finding we can find in mallet finger X-ray. Again, one more X-ray I have got. Same picture, I mean a different picture, but the same finding. See, you can see the bone fragment which has come from the distal phalanx, which is a feature of mallet finger. Alright. Thank you.